Let's see what are the level of amputations. In the upper limb, when we consider including the permanent partial impairment and the loss of physical function, 4/4 accounts for 100% loss in function. Shoulder disarticulation accounts for 90%. Above elbow up to upper 1/3 of arm accounts for 85%. Elbow disarticulation for 75%. Below elbow up to upper 1/3 forearm is 70%. Below elbow up to the lower 1/3 of forearm is about 65%. Wrist disarticulation is about 60%. Hand through the carpal bones are about 55%. Thumb through the carpals and the first metacarpal is about 30%. Thumb disarticulation through metacarpal joint or the phalanx is about 25%. Thumb disarticulation through interphalangeal joint or the phalanx is about 15%. The amputation through phalanx or the disarticulation through metaphalangeals are accounting for 15% in the index finger, 5% loss in the middle finger, 3% loss in the ring finger, 2% loss in the little finger. Amputation through our middle phalanx or the disarticulation through the proximal interphalangeal joint is about 10% in the index finger, 4% in the middle finger, 2% in the ring finger, 1% in the little finger. Amputation through distal phalanx or the DIP joint, that is distal interphalangeal joint, is about 5% in the index finger, 2% middle finger, 1% ring finger, 1% little finger. For the whole finger, loss is about 5% loss in the index finger, middle finger if it is, then 5%, 3% for the ring finger, and 2% loss if it is the little finger. The lower limb, hind quarter accounts for 100% loss. Hip dislocation 90%. Above knee up to upper 1/3 of thigh is about 85% loss. Above knee up to lower 1/3 of thigh is about 80% loss. Through the knee it is 75%. Below the knee up to 8 cm is about 70%. Below knee up to lower 1/3 leg is about 60%. Through the ankle it's about 55%. Signs amputation accounts for 50% loss of physical function. Up to midfoot is about 30% loss. Up to forefoot is about 20% loss, or if it is all the toes then 10% loss. If there is loss of first toe then it is 10% loss. If it is loss of second toe it is 5% loss. Loss of third toe is 4%. Loss of fourth toe accounts for 3%. Loss of fifth toe accounts for 2% loss of physical function.